Are you curious about acupuncture? Have you wanted to try it, but you're just not quite sure? Well, today on Wellness News, we spoke with Dr. Chris Chaplot of Healthy Ways Wellness Center.
Hello, I often get asked by my patients, what is acupuncture? Tell me about acupuncture. What is it all about? So I put together a little summary that I'd like to talk about. And what is acupuncture? Acupuncture in terms of Western medicine has a few different mechanisms of action. I like to say that acupuncture is a catalyst to encourage the body to do what it ultimately does and continually does. And that is to heal, recover, and maintain homeostasis. When we strategically insert these very fine filiform or thread-like needles into the body, we are causing a little microtrauma to the body. It's very comfortable, and in turn, we stimulate anti-inflammatory activity, and by doing that, we stimulate the immune system. And by doing that, we also increase vascularities. The other benefit that we're finding is that it stimulates the brain to release serotonin and endorphins, which are feel-good healing chemicals, as well as encouraging the brain to activate the parasympathetic nervous system, which is the area associated with rest and digest, and helps with recuperation in general. My role here as a doctor of acupuncture is focused on many different people of all different ages that come here with a myriad of different health complaints and disease states. It can be issues from musculoskeletal and nerve disorders, pelvic inflammatory disorders, digestive issues, infertility, headaches, insomnia, etc. And of course, there is a strong interest in treating different types of pain conditions. So obviously there can be pain associated with menstrual cycles, acute and chronic pain, whether it's fibromyalgia or even tennis elbow. The other benefit patients can really have is to support emotional life. There's a number of studies showing that acupuncture has really demonstrated benefits for mental health, specifically depression and anxiety.
Go ahead.
Our experience in Western medicine with needles is with hollow injection needles. I think it's very challenging sometimes for my patients to get past that sort of mental block. I've never had a patient walk away because they thought the needles were painful. It really is by and large painless. It's very important for patients to remember if something isn't comfortable with acupuncture, we want to fix it and we can. We can adjust it and make it completely painless. And most patients really surprise themselves and how relaxed they get, even with the first treatment. What I always tell my patients is that acupuncture is dose dependent. You wouldn't go to a physical therapist one visit and expect to have full range of motion and strength back, or to exercise once a week and expect to have fitness gains. I mean, you might feel good, but you really won't gain much from it. So acupuncture is the same. There's wonderful experiences where patients do get this tremendous benefit from just one treatment. And I certainly love providing that type of experience, but that's not by and large the rule. It is therapy, and patients do need to commit to a bit of a regular regimen. What I also think is important is that patients know that many times acupuncture is very effective for managing symptoms in general and can help the body make a shift towards better overall health. But it needs to be taken on with other integrative modalities that I provide or my colleagues do, such as herbs, exercise, nutrition, counseling, lifestyle changes, to be really effective in improving the quality of life to an existing complaint. Thank you for listening. Again, I am Dr. Christopher Chaplot, and feel free to reach out to Healthy Ways Wellness Center. Thanks again.